Thank you, Erin. Thank you, Rohan, for your kind invitation. Well, this is my disclosure. Of course, the advantage of the images has the possibility to make early diagnosis and better treatment, but for us, for the surgeon, has the possibility to use these images in our surgical practice. We use in the preoperative planning, and some people say it's not planning, it's planned disaster, and I totally agree with these sentences. For that reason, today we have the possibility to localize our tumor relation with the basal, etc. And today we have the possibility to make, at the moment of our surgery, the intraoperative planning, because we have the possibility to change something with the previous studies, with the evolution of the oncologic disease, etc. Of course, when we talk about the images in our surgical practice, the most common and cheaper is the use of ultrasound. The problem with the ultrasound is we need training, and it's not easy to understand the images and the reconstruction to the 2D in the screen and 3D in our brain. For that reason, we need more technology to help us. In the previous lecture, we talked about this, is the idea to use some electromagnetic navigation system during our surgeries and during our ablation. The problem is all of these electromagnetic navigation system are related with some specific company and some specific microwave ablation. In case we need, for example, for some reason, one cryo, one IRE, or one radiofrequency for ablation during our practice, it's not possible to use this navigation system. The other thing is we have the possibility to use, in this case, optical navigation system or optical and electromagnetic navigation system in our percutaneous practice. But we use more and more mixed reality, the union of virtual reality and augmented reality, and with the possibility to interaction of the digital and the physical world. For example, in our percutaneous ablation, in this case, we have the possibility to view the liver with the vessels, with the tumor, and use another electromagnetic navigation system with the idea to localize the target and place the percutaneous ablation. But we have the possibility to use the same mixed reality in our laparoscopic, or in this case, robotic surgery, with the idea to localize the trocar in the specific place for the tumor and for the patients, and has the possibility to use inside during our robotic surgery the localization of the tumor in the organ, and has the possibility to view the tumor and the relation of the tumor with the vessels in our resection. The problem of all of this technology is the patient breathe and the surgeon move the organ. For that reason, we need developing dynamic mixed reality. And we work this technology, work with our engineers in percutaneous, open, laparoscopic, and robotic surgery. This is the solution of the problem, not really, but is the correct way to resolve the problem. We use more and more dynamic mixed reality with the idea to the interaction of the mixed reality. We have the possibility to use some model, and this is very important for training, for planning, and use during the surgery too. Really, I prefer not use the smart glasses during our surgery because it's more than 10 minutes, 15 minutes is necessary to change. We have the possibility to use this technology not only in our planning, it's a training in use in the metaverse for training or in mentoring and the long distance. The technology is useful, but it's beautiful, but it's useful. Well, the first paper was this paper present in showing SAGES 2018 and published in 2019 of our team. about the beginners without experience with technology has better result than the expert without technology. For that reason, the technology is very important for our and democratizes our surgery. In the same study in 2021, demonstrated in ablation when we use technology has better results and lower local recurrence when we use technology. And in my opinion, the most important paper is the last year paper to show the people use expert more than 1,000 cases with technology and beginners without less than 20 cases has the same results, oncological results. Of course, it's not necessary, please not kill the old people yet, but because the experience is important and the technology has not possible to supply the experience. When the case of we have the complication and some which cases is use one technology or other. For that reason, and we finish my presentation, is the concept is the computer-assisted surgery. This is a new concept on this century. It's the broad uses of information technology frameworks to enhance our physician skills. But it's more than this. It's augment our sense with the image-guided surgery, is a spectrum with ICG and hypervision, and the cognition with artificial intelligence, and the execution with the robotic, with the aim of provide more precise, more simple for our surgeons, and more safer procedures for our patients. For that reason, the future is here. What now? Some paper published in the surgical endoscopy say the death of laparoscopy. I think it's possible in the future, not today, but remember the future will be the computer-assisted surgery and robotic, not 100% out with automation, but move to the level 0 today. Or robot artificial intelligence is not used in the robotic today. It's not autonomy, but move to the number 2 or number 3 with some partial automation will be the near future for our practice. Thank you very much for your kind attention.